Namaskaram, Mana.
Namaskaram.
Namaskaram. Welcome back to the podcast with Dr. Vishal Ranbhare. We have seen quite a bit in the first episode. We got introduced to Dr. Vishalji. In this short episode, we'll get a little more in depth into Homeo and how Homeo looks at individuals and how it can be beneficial for the whole planet.
Hi Nishant. Good morning. Thank you again for having a good meet today. First of all, today I want to start with having a blessings from my gurus who have taught me the homeopathy and who helped me to evolve in homeopathy till today. First I will have a blessings from Dr. Samuel Hahnemann, who is a founder of homeopathy, who has pioneered the homeopathy with his own approach. And first, we received it blessings from him. Thank you. Second, I want to mention the guru who has taught me the first step in the homeopathy is Dr. Milind Kulkarni. He
Mhm.
is from Miras, Maharashtra. Because of him, he today what I am. He is practicing in homeopathy last more than 40-45 years. He is a good human and he allowed me to sit in his clinic and allow me to practice homeopathy. He allowed me to train myself under care of him. And the third person which I like to mention is Dr. Praful Vijayakar. He is a fantastic human being and he himself is one of the pioneer in homeopathy. He has made the homeopathy so simplified that
Mhm.
is helping each and every homeopath to practice on daily basis. It is difficult to understand homeopathy as Dr. Samuel Hahnemann has what we call it as a manual. It's a tool of a manual. It's called as a organon of medicine. It's a one subject in homeopathy. And that organon of medicine is difficult to understand. But Dr. Praful Vijayakar has made it understand so simplified. He has simplified everything in a proper way. And that is helping even today for me also and to every homeopath. Thank you and thank you for his blessings today. And because of him, we are practicing today as a good homeopath.
Thank you. Thank you very much for sharing that, Anna. It's a blessing that we have such individuals walk this planet and create more individuals like you that is
Ah,
helping more people. I think it's a blessing for all of us. Maybe in future, at some point, I'm really wishing and hoping that you will be able to at least make the organon of medicine share whatever the wisdom you gathered from your gurus and your own experience, make it available for others,
yeah.
because a principle is captured very well in that organon of medicine.
The principle has been so properly organized,
Hmm.
we don't need to change it at all because it's
Hmm.
years of experience and
Hmm.
years of observations and that has been put forth in a proper way. No need to change.
Correct, Anna.
Proper use of principle itself is enough. To walk on the principle is always a difficult task.
Yes, that is the difficult task. We will talk more about that principle and walking on the principle and
Yeah.
how it is difficult for people on the spiritual path to walk on the principle, how it is difficult. Always trying to look for shortcuts and forgetting the foundation. So, Anna, would you mind describing a little bit more about homeopathy and how you look at things, how
Yeah.
a drug is developed and, generally like
Yeah.
the basics.
Yes. In the last podcast, we have talked about the person. We treat the person, not just the disease. What does it mean? What we treat it actually? We treat the person as a whole. What exactly the whole means? It's definitely it's a body and a mind, but whole itself is means every system within the body is cooperating each other to functional as a one unit. Even the one system is getting affected or disease is getting into it, but still it's a whole organism or a whole human itself is affected. In homeopathy, there is one concept or one principle, a basic foundation. It's called as individualization. It just simply that every human being or a person is unique in itself. Uniqueness part which is differentiating one person with another person. In homeopathy, we try to understand the person or the qualities of
Hmm.
that individual being. What are the qualities? What are the traits? What is the dominant trait in him? How he is surviving in the situation
Hmm.
or in his own life, throughout the life? How he is surviving? What defense mechanism he is using for survival? It is the basic of homeopathy where we understand it appears to be as a common to everyone, but definitely we are different in our approach, in our attitude, in our thought process, in our response to response and our reactions, whatever it is. It is completely different from one to another. And
Okay.
that differentiating point is called as individuality. While studying the case as it is, we evaluate that person step by step.
Every individual is unique. Every individual is looked at differently in a unique way, case by case. And
Yeah,
then the individual carries a set of qualities in their
yeah,
body and mind.
yeah,
And there could be one dominant quality that
yeah,
defines the individual, or that the individual uses as a defense mechanism for survival.
yeah,
And that is the most dominant one in any individual.
yeah,
Okay.
yeah.
Beautiful. Yes.
In homeopathy, we call it as a constitution.
Constitution. Very
Constitution
good.
of that being.
Perfect. It's the same in Ayurveda also. It's called constitution to describe a person. Yes, yes.
Because definitely it is a response of that. What response he will give, we don't
Mm,
know. So it is
correct.
a response we have to initiate how he is
Mm.
responding it.
And when you're talking about the defense mechanism, or the dominant characteristic or trait or quality, is that a good thing or a bad thing, or is that what makes somebody a unique person?
See, we all have all the qualities within us.
Mm,
We all what is required for our survival.
okay.
Nature has provided everything for a survival in the best possible way. We use all our defense mechanism, whether it is on the body, whether it is on the mind also. It's whole one defense system itself. How I will respond, it is depend upon what it is inherited by me and certain things which is required according to situation. What we do is
Mm,
the need of that situation because for that situation, every
mm.
person has to survive. He use his tactics.
Tactics. Okay.
Yeah.
And at one point you mentioned that these things are inherited. So from where are we talking about? Mother, father, ancestors, like, or is it
Yeah.
combination
Yeah,
anywhere?
yeah. Anywhere.
Anywhere. Can it not be possible that they could have acquired from nature also? Because once they come into this body, the
Uh-huh.
situations outside the nature, can it not make them develop different qualities in the process? Can their dominant quality
Yeah,
change in the process?
few things is acquired by us for our survival.
Okay.
See, I will explain you. See, simple way we call it as an adaptation. For
Okay.
our better survival, our body is so simple. It make
Ah,
adjustment or a compensation for survival
okay.
according to situations.
Okay.
What is needed, body is doing that.
Body is already doing that.
Yeah,
But why is it that two different individuals in the given the same situation they do different things?
that is called as individualization. In
Okay.
a given situation, the response is definitely going to be different because
Okay.
what are the qualities they have within themselves, according to
Mm,
them, they will respond. And what is dominant quality inside the person is
mm,
definitely going to respond according to that way.
okay.
If I have the quality of anger, which is dominating inside me, what you are expecting? Definitely, it is the anger
Anger.
which is going to be dominant.
Correct.
If the
Okay.
quality is of fear dominant in me, definitely the quality of fear is my
More expected.
more
Okay.
expected.
Okay. 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 I see. I see. I see. Now, the problem is some of these qualities you're describing, anger, fear,
Uh-huh.
greed, jealousy.
Mhm.
Generally, we look at them as negative traits, negative qualities.
Mm-hmm.
Obviously, depending on the situations, maybe for survival, they are needed in some certain situations, but
Ah,
only in extreme situations, probably we need them. On day to day level, we don't need to have them continuously. You're leading a decent life in Mumbai, for example, or Hyderabad or Bangalore, earning well, your parents are earning well, you're doing well and everything. Is there a need for such a quality? Or is it something that, what is the
yeah,
problem with such individuals when they're
it,
continuously expressing desire, fear, and anger?
it is needed. That's why we have all the qualities. Nature has given it. How we will survive without all these qualities? We need this. The only question is it within my control or not? Whether
Huh,
I am responding it in a better way or not.
huh,
Whether I am, the question is about only about awareness. Even if it is aware, and
mm,
it is, and we have to respond according to the situation only
okay,
because it is required for
okay.
better survival.
So if the qualities are built into every human being because you're born on this planet, anyway,
Uh-huh.
everybody has access to this quality. Depending on the situations, different qualities will get expressed.
Yeah.
So there's no problem. Why are people suffering then?
See, that is a total different aspect of it. Why they are suffering. I have no. If you'll ask me about the sufferings of every human being or every
Mm,
individual,
mm,
definitely according to need, they will suffer. For example, it's their expectation, probably. They are not able to figure it out how much they are required for
okay,
survival.
okay.
That is one of the factor.
I guess where I'm going with this is, at what point do you decide that somebody requires medical attention? Because you're saying we are all responding in situation is demanding,
Yeah,
maybe at
but
that situation is
no,
demanding and
no,
everything,
no.
right?
I will come to this point. Symptoms are present in two different manners.
Okay,
The symptoms which is present in acute conditions. Acute conditions, the symptoms or the pathology or the things comes in a very rapid and speedy way.
okay.
It's like sudden onset is there,
Mm,
and it has its own speed, and either body will recover of its own, or it will lead to the death
okay.
in mostly of acute conditions. But for chronic complaints, for a
Mm,
chronic cases where the
mm,
patient is suffering from long period of time, years, more than 6 months, more than year or 2 year of a long sufferings they have.
correct.
It is because of the tendency they have.
Okay.
In homeopathy, we call it as a miasm.
Miasms. Okay. Can you talk a little bit more about these tendencies and miasms?
Tendency and the miasm is itself is a defense process. Anna.
Okay.
Yeah, because how he is responding
Mm,
consistently, we have
mm.
to look for that. You can say miasm is a pathology
It
in a
is a
simple
pathology. Okay. Okay.
in a
Mm.
simple way. This is a term is coined by Dr. Samuel Hahnemann.
What I'm saying is, at what point do we classify a quality as a miasm? Because tendency and the qualities you're describing, they're sounding the same thing to me. When will you say it will be a miasm and it's not simply a quality you're responding to every moment?
Miasm is a defense process.
It's a defense process. Okay.
I will explain you as if somebody is having the fever,
Okay.
he is suffering from the viral fever.
Okay.
He will show the symptoms of all the inflammatory in nature.
Okay.
A person is having a tumor.
Okay.
Here is a defense mechanism is growth.
Okay.
Something is growing inside.
Okay.
The cells are growing inside.
Growing inside. Okay.
That's why it's a tumor has formed.
Okay.
Or it's called as accumulation. Sometimes a fat get accumulated. It's a process, either growth or accumulation.
Oh.
This is second process, the
Okay.
second defense.
Okay.
There is always a first uh, defense, that is inflammation.
Okay.
Second, it tries to be second is as a growth or
Growth or
accumulation.
accumulation. Okay. Okay.
And the third itself is a destruction. We call it as a gangrene or it's a autoimmune disorder get.
Oh.
People get suffer from autoimmunity.
Huh.
It's a destruction of the part itself completely.
Okay.
Human body use three defense mechanism.
Oh.
First is inflammation.
Hmm.
We call it sora. Sora is a miasm. So if he is using first defense mechanism as an inflammation, we call it as a sora.
Okay.
The second defense, we if the first one is not able to eradicate or conquer the battle, the second
Hmm.
defense the human body uses a psychosis, miasm, psychotic miasm. It's a
Okay.
growth or accumulation.
Accumulation.
And the third is destruction, called as
Okay.
syphilis miasm, syphilitic.
Syphilis. Okay. Okay. Okay.
Syphilis is not a disease. Which is,
Hmm.
syphilitic is a defense. It has
Okay.
its own features. See, psychosis has its own features, qualities. How you will say this person is using psychotic defense? The person is in soric defense. The person is in syphilitic defense. It's
Hmm.
a it's a weapon or a tool they have for better survival.
Okay. Psoric defense is inflammation.
Yeah,
It can appear in different types of inflammation.
yeah, anywhere,
Okay. Anywhere.
anywhere.
And psychotic will be little more accumulative,
Growth,
warts, those growth, excess growth
growth.
type of thing.
Yeah, and even the acute inflammation can be go into chronic inflammation. That inflammation can be remain for a longer duration of time.
Okay.
That we call it as a chronic inflammation.
Chronic inflammation. Okay.
So every patient, every case,
Hmm.
every symptom
Hmm.
has to be differentiate between the two.
Okay.
Either it is acute, either it is chronic, and according to that we take a approach.
Okay. This is beautiful. So now you have classified the case to be chronic, for example.
Huh.
You know it's a chronic case.
Yeah.
At this point, where does the mind and tendencies come into it when you are evaluating this?
In chronic cases, most of the time it has came from within us only.
Okay.
That's why we take a family history. Is it we have any same family history? The person is suffering from diabetes,
Okay.
hypertension,
Hmm.
psoriasis.
Hmm.
Number of such chronic cases are there. Once it happens, it happens. So that is the reason we took the case. We understand whether we have a family history of this. First thing. Second thing, we look into it. The how he is defending itself. Our body and the mind is one unit.
Okay. It's the same
Okay.
thing.
The same thing. If the body is showing the symptoms of psychosis or second defense mechanism he is
Second.
using,
Hmm.
yeah. Before it comes into the body, the mind has to be in that mode also.
Oh, it happens first in the mind before it
Mind,
manifests in the body.
yeah. First is software, then hardware.
Oh, so it's always the software first. The program
It
is
is
already
always,
there.
yeah.
Okay. Okay.
That is the reason why homeopathy look for a software and hardware both. That
Uh,
is why the reason homeopath look for a body and the mind at the
mind.
same time.
Okay.
He is evaluating him, the person
Hmm.
itself completely. So what is there in the mind and what is there in the body has to be same because it is the one and the same unit.
Okay. Got it, Anna. Okay. Wow. Uh, it's becoming clearer how you're looking at things now. I'm just drawing a parallel. Like from the yogic perspective, tendencies are looked at a little different because not everything is pathological in nature. Not all tendencies need to be in the miasm state, acute state, or chronic state. They're there. Everything is there, always there.
Yeah,
Like you were
yeah,
saying, every human being is born with many things. They looked at this to figure out the root of these tendencies. Where is this root coming from? Why did they do that? They did this because these tendencies are already there within us. The root is there, the seed is there, that's where they're growing, they're expressing. They wanted to get to the root and they wanted to uproot it. The whole idea is when they want to express fear, it should not be the fear from something within. If the situation demands it, they want to express fear. If the situation demands anger, they will want to express anger. So they want to have control over all the tendencies rather than tendencies controlling them. So if the tendencies are already deep rooted within us, we say they are going to control us. every tendency, if you simply follow it in the meditation process, you can go to the root of it. Okay. And when you're observing the tendencies, that tendency will get dissolved over a period of time. That is a process of yoga.
First thing is knowing your tendencies,
Correct.
and second thing is you're talking about acceptance of that tendency.
Correct. That's it. Yes, the acceptance.
The
So
acceptance.
first, until you accept, it will not happen,
Oh,
right?
yes.
Because you're in denial. That means, like you said, if the mind, if within in your mental framework, if you don't accept it's there, then it will not. You will never be able to uproot it.
Yeah.
It's not in your awareness and acceptance.
You're talking about knowing the first tendency and accepting the tendency.
It is like this, Anna. So when you go into the meditative process, you may or may not even know the tendency exists. But once you come to know the tendency is there, you have to accept immediately
Oh, okay.
because you don't even know
There
up till
should
that
not be a
point.
resistance, you're saying, right?
Ha, there should not be any resistance.
Resistance.
You are what you are.
What you are. Yes.
Ha, when you start denying it, that is the food for the tendency.
Oh,
It will grow and grow and grow, and the resistance will increase and increase and increase. The more you resist, the more it will feed on it. It becomes denser and denser.
by accepting the tendencies, it means we are losing it or we are reducing its intensity.
It is a bit like this. Yoga also says you are an individual, but because you are part of the universe, you have access to all the tendencies any which point. They don't need to be a part of you for you to have access to it. So you can use the tendency when you dissolve it, whenever you want to, rather than anger trying to control you, overpower you.
Okay.
Okay, there are multiple ways of going about it. So there's different paths in yoga. Different paths go about it different ways. So the whole point of becoming a human in yoga is all these tendencies are there. They should not control you. You should be in
So,
control of them because depending on the situation, you use whatever you need. That much freedom you should have. Group of tendencies, for example, you have mango trees. We have 5 mango trees. They're all the same kind. So we call them samskaras. One samskara, two samskara, three. Bunch of samskaras put together is called
uh,
karma. You are karma. The environment itself will create certain tendencies within you.
it means the environment itself creating certain tendencies within us.
Mm.
It means it is required for survival.
It is for survival, absolutely for survival. So you can make use of them.
So nature is always helping us to survive in a more better way and best
Correct.
possible way.
Yes. See, I'm born in Hyderabad. That means you're definitely, you have all the defense mechanism to conquer the Hyderabad environment. So, overall, just to summarize what we discussed so far, the tendencies, if they become pathological, they're referred to as miasms in homeopathic terms. It starts with acute, and then slowly
Yeah.
it could become chronic. And sometimes by the time the somebody comes to you, they probably are coming to you at the chronic state itself. So, is it possible for you to take up an
Uh,
example of somebody?
yeah. She is a 40 years female. She came to me for thyroid problem basically because somebody has told her that homeopathy works with thyroid, and she was on the thyroid medications from long term, as it's a hormonal disturbance basically, and this hormonal disturbance affect the all this because hormone system itself is a controlling system of the human body.
Correct.
So it's affecting it's her control only all over
Hmm.
the, and the hormone it's affecting every system of the body, and its a main function is to control the things, mostly metabolic things to be
Okay.
controlled.
Yeah.
So she has came for me, but most of the thyroid patient also shows the symptoms of depression,
Hmm.
mostly mood swings disorders they have, and most of the patients also shows the, in their pathological findings they show the positive anti-TPO. That is itself is a biomarker. We find it in the blood.
Okay.
That is a antibody against the thyroid. So when we find the antibody itself within the blood against
Hmm.
the thyroid, it means
Hmm.
your own body is against your own organ.
Correct. Correct.
So it is autoimmune disorder.
It's autoimmune. Yeah.
Autoimmune disorder itself indicates there is a tendency to destroy our own self.
Okay,
So,
self-destructive tendency. Mm.
so it is also showing within the blood, and at the same time, as homeopathy is concerned, we see the same tendency should be in her mind.
Correct. Because software would have been already been present.
Is present.
Okay.
Yeah.
Yes, yes.
So we go into that aspect.
Mm.
Okay. So she is presented with hair fall, which are the common
Mm.
symptom of thyroid disorder. Mood swings होता है. Second thing is constipation most of the time, and sweating होता है. Sweating is there. Sometimes people show in the severe cases trembling also.
Okay.
Sometimes it
Mm.
will depend upon the individual constitution, which showing the what symptoms she will present. Common
Okay.
symptoms are there, but few
Uh,
symptoms which represent the person itself only, directly to the her
uh,
personalities. So the when she came to me, already she was taking the anti hormonal therapy last 10 years. She was taking that. All investigations has shows that is anti TPO positive with autoimmune disorder. Now the
mhm.
question is coming, only the hormone is giving from the outside, from the what a convenient way of practice people are doing. They give the hormones therapy to control all the mechanisms of the body. But according to homeopathic approach, what we do is we try to understand why the autoimmunity has developed within herself.
Yes, Anna. Yes, yes.
Huh.
Okay.
Now the question is why her body is showing the autoimmune disorder
Correct.
within the blood, within the body, on the physical aspect. So, as a homeopath, we see this as a chronic disease, long duration of
Mm.
10 years of this. Chronic disease? We always try to find the constitution of the patient.
Okay.
What constitution of the patient in homeopathy is very much important factor, because once we find the constitution, we are finding the person itself basically.
Itself. Correct, correct, correct. Huh.
Finding the constitution, finding the person itself, because we treat the person itself in homeopathy.
Correct, correct.
Once we treat the person itself, pathology will definitely be considering into it, because the pathology is chronic in nature. It has evolved from the person itself because
Itself.
of
Okay.
tendency what she is
Correct,
having.
correct, correct. Huh.
So basically, we are treating the person which is having this tendency to for autoimmune disorder.
Okay, correct. Yes, I understand. Yeah. So the autoimmune condition that you're talking about now, that's the syphilis stage,
Yes,
right?
because atom means self.
Mm.
Self immunity is destructing to the body. Oh, whose body? Self body.
Self body. Okay. Correct.
Which organ? Our own organ, thyroid
Organ.
organ.
Correct.
So our own body
Destroying itself.
destroying itself. This is destruction, self destruction. So body should not do this, but it has happened. That's why it is called autoimmune disorder or autoimmune disease,
Correct.
because it forgets its own nature. This is you only.
Mm.
Even in the conventional, the if you go the articles of what we have about thyroid disorders, it is more common in female only, basically.
Okay. Huh.
Yeah, it is common. There are a number of reasons to it. We will not go into it details.
Mm-hmm.
Now, as a homeopath, he has to look for the autoimmune disorder to settle down. From her childhood, how she is behaving, what is her mindset from the childhood. From the childhood, how she has evolved till the age of 44. What was her behavioral pattern in the past, in the childhood, in the teenage, in the college days, before marriage, how she is, after marriage, how she is, and in every situations of the life, how was she is responding to the situations. Yeah,
Okay. Huh. Huh.
because
Yes.
yeah, because in as a human being, we have number of life situations. We
Correct.
cannot
Correct.
every second we have a different situation.
Yes, Anna.
Every moment we are going to face a different situation, and every moment we are going to respond accordingly,
Yeah.
whatever we have.
Correct.
So most of the patient, what she is talking about is always she used to having a tendency of weeping. When the fear comes, she weeps. Any situations comes, she weeps. So this is the way she is surviving, because
Hmm.
she is mild, sensitive, emotional
Timid.
female,
Okay.
timid in nature. this is a way of what the she is showing the qualities of herself.
Mm. Mm-hmm.
Uh, Even in the school days, she used to sit in the last bench, in the middle of the bench, because
Mm.
she don't want to come in front. She wants to go back on the side
Mm.
because she herself has few things in her mind that she's incapable of handling the situations.
True.
True.
Correct.
So that's why she
Okay.
don't want to come in front and face the situation the way it is. So sitting on the bank bench is a
Mm.
hiding. Itself is a escaping. You got my point.
I'm a backbencher.
you So not all the backbenchers are timid in nature, but I'm talking only about related to this patient. Backbenchers are mostly mischievous in nature.
Yeah, yeah. We used to
Basically,
have sort of fun.
they want to, but they're the backbenchers for
Mm.
those people who are having the fun.
Ah,
Their tendency is different.
different. Okay.
But but what we are talking today, right
Ah,
now,
okay.
she is having the tendency to sit on the backside because she don't want to face the teacher in front of her eyes. This is hiding.
Hiding.
This is
Okay.
escaping. So in the
Um,
school age also she is escaping.
correct, correct, correct. Huh.
Yeah. When
Yes.
she is into come college days,
Mm.
what was her ambition in the life? What I asked
Mm.
about her. She said there is no nothing as ambitious in my life. I don't have any ambition in the life.
Ambition.
This is what
Mm.
her ambition.
Okay.
Because most of the timid, mild people and
Mm.
emotional and sensitive people has a confusion tendency. They can't
Confusion.
decide
Ah,
because
correct,
they don't
correct.
want to come in front of the life. To achieve the ambition, you need obstinacy. You need a
Yes.
strength that you have
Mm.
to have your own will. Though they don't come in the decision level. They always
Okay.
confuse in the decisions.
Level.
What
Okay.
to do.
Got it.
They always take somebody's help. You got my
Correct.
point.
Yes, yes, yes. Absolutely. Yes.
So again, in the
Okay.
college days, also she is confirmed that she is confused. She is not able to take the decision properly. Right
Yes, son. Yes.
now, again, this is a tendency of what hiding only,
Hiding only.
not coming,
Correct.
not
Correct.
coming in front of the life and straight
Correct.
taking the decisions. It's a
Correct.
hiding only.
Yes, Anna. Ah.
This is all coming out of fear.
Fear. Okay.
You got my point?
Yes, Anna. Not every fear behaves the same way. Correct. This is a
No,
like the different types of
it
fear.
will may depend upon how the person is evolved, how many situation he
Ah.
has gone through.
Okay. Okay. Got it. Got it. Huh.
And later on, I understood that from the childhood only,
Mm.
from the basic, she is
Mm.
surviving by having the timidity,
Ah,
by yielding in the nature.
got
She
it.
is yielding in every situation of her life, in every decision
Okay.
of her life.
Ha 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 ha.
So this is the way she has evolved. So
Yes.
slowly, she has evolved in such a way. Now
Mm.
the thought comes, it is me who is incapable.
Yes.
Now the gunpoint is towards herself. I am
Herself.
incapable. If I am incapable, it means I am the problem. Though the thought has came, she is cursing herself.
Ah ha 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 ha.
It
Okay. Got
means
it.
it is destructing herself only.
Herself only. Okay.
This is what the software works.
How did you come to this part? I mean, when you are talking, see, the only symptoms she came to you with is blood reports and the thyroid test. That's it.
Yeah. Yeah.
Blood work and thyroid test. That's it. That's all you have. How did you get to
Yeah.
this part?
This is all homeopathy teaches everything. Homeopathy is a
Okay.
big science.
The diagnosis is done. She's, in a way, she's pointing gun towards herself because she feels she's the reason for all the problems. She's the problem.
Yeah. Yeah. Now, according to homeopathic approach, we
Mm.
have a number of medicines.
Okay.
We have a Now we have understood her pathology or on
Mm.
physical aspect, on diagnostic aspect. We have understood the pathological reports. We have understood his software. We have get all the qualities of her. Now we match this quality with our medicines. And
Okay.
what medicine will come out of it, we give that
Mm.
medicine to the person. Now the medicine is in on that. See what happens is we look person in a dynamic level. So our medicine has to be treat the person on dynamic level only. It's
Mm.
energy medicines. At what level the energy is disturbance, at
Mm.
that level we have to match the dose of the our medicines too. So
That is
it
the
will
potency.
that is the potency what I'm talking is. if you ask me, does
Mm.
the it contains the medicine? I will
Mm.
say it contains the quality of the medicine, the
It,
higher energies of the medicines that we transmit to the patients.
okay.
And at energy level, we treat the case as we're talking about the tendencies. From that energy, we are improving the patients itself.
So you are saying, based on the tendencies and your diagnosis and everything, now you have a case. You know the
Yeah,
case, and it is resembling a certain element or certain mineral or something. Correct.
but right.
And you will be giving that mineral only. But the
Yeah,
problem is
yeah,
the person is already that mineral. Why will you be giving more of that mineral?
yeah. The person having the same quality,
Quality,
we are,
correct.
yeah, but we need to stimulate that person. We need to stimulate his energy. You got my point.
No,
Second
no,
thing, no, say
no.
a small force. We this is a small force.
Correct. Okay.
I will give bigger force.
Okay. Huh.
This force will be under my control. How much I have to give?
Okay.
This is disease. This
Hmm.
is not controlled. This is
Correct.
controlled.
Controlled. Okay.
It's like similia similibus curantur. It means like cures the like. This
Okay.
is the principle of homeopathy.
Ah. Wow. Okay.
Yeah.
Okay. I
So
see.
this bigger force is under my control.
Hmm.
I had delivered this bigger force to the person of same quality, same nature, but in
Hmm.
a higher level of
Higher level
potency or a
potency.
higher
Okay.
level of force I apply to it. This is a body. This
Correct.
is a body.
Hmm.
This has to respond to this force.
Uh-huh.
Now this body responds to this force. Ultimately, the
Hmm.
force has increased. Now I
Correct.
reduce this. So I am improving the person itself.
I'm just saying, for example, in this
Mhm.
case, we are talking about the quality of fear or
Uh-huh.
the person thinking she's the problem. Say that's the quality we are trying to treat. For example,
Yeah, yeah,
maybe, okay.
yeah.
And now you gave a dose or you gave a medicine that has a similar quality of fear and that thing that feels that they are the problem. For example, when you give more of that, will the person not become more fearful? Will it actually dominate that
Uh,
fear inside?
no. Now the response we wait we have a different response of a now the response of a patient will come.
Okay.
Now the response will be differ. For
Oh,
example,
okay.
that's why in homeopathy there is little of aggravation initial period of time.
Okay.
You got my point.
Yes, yes,
This is
yes,
the
yes.
point. Yeah.
Yeah.
That's why in homeopathy the same disease get aggravated for initial period of time.
Got
Only for a limited period of time.
period of time.
And that too the patient is stable and
Hmm.
it's a mild aggravation. Mild.
Okay.
Then it reduces doppling.
Wow. This is
Yeah.
completely different from all schools of medicine. Absolutely different.
Obviously,
Absolutely
this
different.
is this is the new modern way of approach basically
Hmm.
where physical mind and even tendencies and it works on energy levels I'm
It
talking
works on
about.
the energy level. Correct. Correct.
That is the reason it is 200 years old back only. That is why it is 200 years old and it is a need of the situation. That's why it has came.
This is for me. It's mind blowing because I've never heard something like this. I'm trying to still wrap
But
my head around this. Huh?
see, but to practice homeopathy, you
Yeah.
need lot of things.
Okay.
The most important thing is the difficult time for every homeopath to sustain his daily life because people doesn't come so easily to the homeopath. And second thing,
Correct.
not all homeopath has same ability or the same thought process or the
Approach.
same approach to treat the every case. It takes life. We have to give whole life into it. Is sacrificing everything and just complete devotion to the one thing.
We call it sadhana,
Okay.
what you're doing.
Hmm.
Dedicated practice and
Yeah.
100% involved.
Involvement. Yeah.
Your life goes into it. Your life energies will go into it.
Yes. 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 Yes.
And you are responding to another life very consciously. And you're trying to
Yeah.
see what is the best needed for that
Yeah.
situation and offering yourself.
Yeah. Yeah.
Thank you very much for existing for
Yeah.
all of us.
Yeah.
Thank
Now,
you for that.
that is the beauty of homeopathy. Homeopathy just not help in treating the patients. It homeopathy helps us to transfer ourselves also. It's
Yes.
transforming ourselves. It's a tool we are helping for others, but at the same time, it helps us too.
Did you ever think of going back to once in a while, going to universities and colleges and giving like guest lectures on this fundamentals to homeopathy students?
I don't know.
It would be very helpful for the upcoming generations because even if one individual finds connection with what you're saying, you're automatically creating one Dhanvantri for the next generation.
No, there are lots of homeopaths who are doing beautiful in the practice. It's not
Okay.
only me. There are a lot of homeopaths.
Uh, I don't mean it like that.
There,
Focusing on the principles and working on the
uh,
principles a little more before they start dispensing medicines.
yeah.
I
That
meant
I
in that
agree.
way. Yeah.
I agree. Yeah,
So it could help a lot more. We
yeah,
should really get into that.
yeah. The same way the what blessings I got from my gurus.
It would be very helpful, Anna. Thank you. In
Yeah,
this podcast itself is, I'm telling you, this is, most people may find it nothing, but I'm pretty sure a keen student of a homeopathy, it should transform him just hearing the last 5 to 10 minutes of whatever we just spoke. Anna, I'm going back to that Akka. The family thought it was depression, I'm thinking.
yeah.
Are you comfortable sharing what medicine you gave and why you chose that medicine? What's the quality of the medicine?
Yeah, I just gave her as a sepia as a medicine, a
Sapia.
fish
Okay.
medicine. It's a fish where
Uh-huh.
they get indifference to their life in the depression phase. They get complete indifference. I will say it's a
Okay.
indifference,
Okay.
indifference to everything. Everything means everything. She lost her desire to live in the life. It's a indifference. They don't feel pleasure in anything.
But fish are comfortable. They enjoy playing. They enjoy doing all
No, no,
sorts of
no, no, no,
things.
no. No, no. That we will
That is
talk
different.
in a different. That is totally different game.
Okay. Okay.
It it's a evolution of a state. It's a evolution from
Okay.
A to B, B to C. When the person go in the C stage and the end stage of the depression, then the person show this type of symptoms. That's why in the earlier postcard I said it is a sora, psychosense, then syphilis.
Syphilis. Right.
Childhood, middle age, and destruction, old age.
Old age. Okay. Got it. The Trimurtis. So
Trimurtis.
maybe I didn't understand it. So please don't mind if I ask this again. That sepia, how does it affect that condition? If you don't mind.
It's not affecting to her condition. It's affecting to her energy levels, her tendencies level, her
Tendencies.
tendency. I am treating as a person to him,
Okay.
person to her.
Yeah.
So sepia is a medicine for her
Hmm.
of her quality is matching. We are matching her qualities as a personality.
The quality here is the escaping quality that you're referring to, or
Okay,
anything other.
escaping quality.
What
But
other qualities?
the mostly they get weeping alone. They are introvert people.
Oh,
The
okay.
other qualities they weep alone. They have a lot of strength. Actually, they are family based oriented. They suppress
Okay.
their emotions. That's why I told you they suppress themselves. They are not
Hmm.
expressing. They are harming themselves. So it's an
Right.
autoimmune only. You got my point. So suppression himself or herself
Hmm.
is an autoimmune. Non-expression itself a destruction.
Destruction. Correct. Correct.
So
No,
same pathology is coming.
okay. The physical level, it's responding the same way. The autoimmune is
Yeah,
doing the same thing. Correct.
yeah,
Okay. Okay.
yeah.
Okay.
Because body and the mind, even it appears to be different, but it's
Hmm.
one.
Correct. Okay.
It's a one whole system.
It started with sepia. And is it possible that there could be multiple layers? For example, sepia worked for a period of time and then you found something else.
Uh,
Is it possible?
no. How will it will take the time? Time will decide now how she
Okay.
is responding. Whether she is responding to the same dose or did she need a change dose? Or sometimes what happened? We get faulty from our side to find the better qualities of a person.
Got
It's
it.
an art.
It is an art.
It is an art. That is why it's called practice. It's an evolving process.
In the modern medicine, there's a
Mhm.
subject called pharmacology, which basically how the drug interacts with the body.
Mhm.
Does Homeo have something similar to understand
Yeah, we
this?
have. Yeah, we have a Materia Medica medicine
Okay.
book, and we
Okay.
have our own pharmacology also.
Okay. Okay.
That is specifically with homeopaths or a homeopathy system.
Correct. So
Yeah,
now the Materia Medica is a, I'm guessing it's a library of everything that Homeo
yeah, yeah.
has.
All
So
medicine has been put it in the proper order.
order. Correct. I mean, I don't know if the college will cover every single thing in it. Maybe not, I'm guessing.
99% it's your own study. Practice is not come from the books.
Correct.
It
Okay.
comes, we learn from patient itself. Patient is more, patient is a bigger guru. Patient teaches us more. That is why we told, it's daily sadhana, it's
Hmm.
daily evolving process. The longer you sit in the chair with complete involvement towards the patient, you also evolve and your practice also evolve.
Got it. Yes. So it is a sadhana, and that's why you've been failing for 16 years.
Yeah, last 60 I am failing
16 years
only.
failing only. Beautiful. Good failure. You're a happy failure.
See, happy failure. It takes lot of nights, take lot.
Yes, yes, yes. Your livelihood also has to be taken care of, survival
Yeah,
livelihood. Along
yeah,
with this,
yeah.
yeah, I completely agree.
It is creation. You're creating something within you first, then you're applying to the patients now. It
Correct.
takes a lot. All over India or globally, all over world, people don't see homeopathy as a primary part. It's a reality. They think this is alternative way of medicine. But it's not like that. In these situations where you are treating as an alternative people or alternative person,
Mm,
even after people or a society treat you as an alternate, even after alternate you have to change the situation. This is
mm,
itself is a big
big
thing.
one. Okay.
Yeah, to overcome all these things.
Maybe I'm thinking half of your time goes into educating only people that this is
Yeah, I always say what is required at this moment you should do that. If it
got
is
it.
surgery, go for surgery.
Surgery.
It is
Yes.
if you want to prefer Ayurveda, go for Ayurveda. If
Mm-hmm.
you want yoga, go for yoga.
Correct.
See, every tool is for our benefit only. Don't compare this as a alternative
Ha. Correct.
because it is also one of the tool.
Tools. Correct.
Every tool has its own place. It has to be respected. It has to be useful because
Mm.
every tool is useful for humanity only.
We'll just finish with that Akka only, Anna. Is the diagnosis complete or is she still in the process right now?
Last 1 year she is with me and she is really doing well only on sepia. I had reduced her thyroid dose from 75 to 25 now.
So thyroid dose means you're giving some other medicine for thyroid.
No, no. The support she is taking from the outside,
Right, right. That is
medication.
also there. Okay.
We can't reduce the medicine which she is dependent on so immediately because
Immediately.
her
Right.
body has adjusted with the dose. Body
Yes.
has to overcome.
Correct, correct.
That's why it takes time. We are not controlling the system. We are
Yes.
repairing the system. So
We-
repairing needs a time. Anna.
Yes, 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 yes. Got it. Yes, Anna.
That's why in homeopathy it takes time. It's not the
Um,
slow.
got it.
We are doing the repairment.
Excuse me.
Basically, we are rebuilding the system itself. So the patient will be free. Freedom.
Mm.
There should be a freedom.
So it is not simply rejuvenation. You're actually rebuilding everything properly.
Yeah, it is restoring person.
So for 1 year, you've been able to reduce the dose thyroid,
Yeah,
and at the same time, sepia is continuing. And how
yeah.
about the visible signs? Is she a little stronger about decision making compared to before?
See,
How does she feel?
reducing. No, the question is that if the dose is reduced to certain extent, the dose has
Okay,
reduced.
okay.
It means the body is functioning normally. Whatever
Yes.
the complaints has been she's having, it has also came down.
Oh, yes, yes. Got it, got it.
So she is restoring now.
Okay,
She is repairing on the repairing path only.
okay. Got it.
You got my point.
Yes, yes, yes. Got it, got it. So it is happening.
It's happening.
This is a sign again. The reduction of
Yeah,
dose itself means
it's
it's repairing. Correct.
repairing. Now body is restoring and
Hmm.
it is in the good functioning independently. And the nature has provided everything to function independently only.
Yes, we are individuals.
We are
Yes,
individuals.
correct.
We are complete individuals.
Some symbiosis is there, but we can function without this medicine and the idea of all of that. Actually,
Yeah, yeah,
when
yeah.
only imbalance, we have to correct it. because of this.
Yeah. This.
The repairing part that you're talking about, that also starts from the mind level only. Is it true?
Everything from the, yes, we are
Okay.
improving the person itself.
And then the science will show a little later. It's like
Ah,
physical level, the science will show a little slower.
yeah, yeah. The repair has to come from center. Body
Uh,
is on periphery level. The core is deeper aspect,
yeah.
and it has to be from center to periphery. It has to be covered.
We have the physical body, and there's
Mm-hmm.
the mental body, and then we go even subtler. There's the energy body. These three are physical. Everybody can talk about
What
these three.
what you are talking about, the energy body, we call it as a vital force.
Vital force, correct. Vital force. This medicine, it's affecting that vital force,
Yeah,
which manifests into the mental body, which then manifests into the physical body.
exactly.
So your study and diagnosis is actually the vital force only, in a way.
Yeah,
You're using
it's a
the
vital force.
you're using the body and mind as understanding that vital force,
Yeah,
how it shifted.
yeah, yeah.
That's
Exactly.
it. Okay.
Yeah,
Oh wow.
yeah.
Thank you. Thank you. Really, really appreciate it.
See, this is all the blessings of my gurus. See the level of the work that Dr. Samuel Hahnemann has done, the
Yeah.
founder of homeopathy.
Correct. He's incredible.
Yeah, later on, there are number of gurus, number of teachers in homeopathy. They have contributed themselves. I feel blessed that I am part of homeopathy.
We also feel
And
blessed that you are part of homeopathy.
and second thing is, I am blessed by my teachers. The Dr. Hanman itself, Dr. Milind Kulkarni itself from Miras, and Dr.
Hmm.
Vijayakar, Praful Vijayakar himself. We
Correct.
always bow down to our gurus.
Yeah, yeah.
They are
Yes.
our teachers.
Yes. And I wish that you, whatever your teachers have offered to you, the gurus have offered to you, and your own experience from the art you developed,
Mhm.
you can package it and offer it to more. Yeah, one Vishalji should at least give rise to at least 100 more Vishaljis.
Oh,
That
yeah,
that is, it should be the goal. I feel that's the only way it can survive. Hana, thank you, thank you, thank you. I cannot thank you
yeah.
enough. Thank you very much
Yo,
for
thank you so
your
much.
time and for what you're doing and how
Yeah,
you're offering yourself to the society and the
yeah.
life at large.
And thank you, Nishanji, for offering me to express myself completely on your podcast. Thank you so much.
Thank you, thank you. We are able to
Right.
stimulate your thyroid.
Oh, thank you.
Thank you, Anna. Thank you.
Okay.
Really
Thank
appreciate it. Okay, thank you. Namaskaram, Anna.